Hi, it's me, Tammy. I know it's been a long time and I apologize. I haven't been able to give you an update since that last horrible video did put on of a brainstorm, and I believe I did note that I was leaving to go have brain surgery. If I didn't, I'm going to give you an update on exactly what occurred at that point of that video that I stated. It is hard to watch, and a lot of you have not seen anything maybe to that extreme of trigeminal neuralgia and hemifacial. I have it on both sides of my brain, which is a true rarity in itself, to have it on both sides and to have hemifacial and trigeminal neuralgia on both sides. And what had happened at that point, I went completely toxic and I was going down fast. When I say going down fast, I called them brainstorms because it go one side to the other side, back and forth in the brain. And my right side was the worst. And God bless me with a doctor that has been at this, and this is his specialty, for over 50 years. If you can imagine, he's 80 years old and he looks like he's 60, and still snow skis and water skis, and he lives in California. And my doctors here sent me there, and doctors know about the disease and they know what they've read in a book, but I'm here to tell you what trigeminal and neuralgia and hemifacial, and I know you feel the same. I'll tell you what it's about. You think you know, you don't know. All they know is what they've read in the textbook, in their studies. But this disease, this disorder, does a lot of strange things to an individual. And I'm a witness to that. Well, I'm a quite strange individual when it comes up. I'm going to have it. I got to go all the way. I get the extreme. My right side of my brain, they did the surgery first on the right. The left has not been done, and I've chosen not to do it. I'm not going to through no more surgeries. I was allergic to everything they can throw at you in the drugs. The drugs have a lot of side effects. I'm allergic to over 20 things, drugs, and every one of them that they can give you to try to block the signal of trigeminal that causes the excruciating pain, to call it the suicide nerve, because they can't give you anything for pain, only to try to block a signal, and they can give is seizure drugs, and I couldn't take not even one of them. And at towards the end, before surgery, I went toxic, so they had to pull the plug on just even the muscle relaxers that I was taking. And what you're seeing now with the brain surgery, normally for trigeminal neuralgia, let me get my frame here, is down at the base, and it's a circle they'll cut out. Well, this doctor, and I'm going to give you his name for any of those that you would want to go there, and your insurance will pay for your trip, because there's no one here. I can promise you, they'd opened my brain, they would have closed me back up. I would not trust any, and not to put any doctors down that aren't qualified. They're qualified to do brain surgery, but this is so intricate in the area that they work on, controls everything. And you know that by anyone that researches trigeminal neuralgia and the brain surgery in itself, what it can do. And stroke, I mean, you could be a vegetable if something goes wrong. And that's why doctors don't want to touch it. And you don't want anybody touching your brain that hasn't had a lot of experience. And the ones I researched, they were young, and doesn't mean they're not qualified. But I had a doctor that had over 50 years of experience. And you can imagine the brains that he had opened up and seen. And when he opened mine up, and to back up a little bit, he sees things on the MRIs nobody sees because they're so small, these nerves and blood vessels. They don't see nothing. No doctor I've ever had in all my years, if you knew my history and my background of battling a horrible case of Lyme disease, that of course, like I said, I seem to get the extreme. I was one of some of the worst cases they had seen, and was even going to send me out of the country to try to do treatment that was illegal here to try to save me and help me with Lyme disease. I've seen literally hundreds of doctors. I'm sure over 50 MRIs. Nobody's ever seen none of this in my brain. It takes a gifted man, and this man is gifted. He sees things. God has given him a gift that nobody sees. And he saw that the right side was worse. And he says, Tammy, when he saw me when I went to California, he says, you're worse off than I ever thought. We've got to do more because it's a special MRI. And I think I'm saying it right. They do normally a wider span of slices, and they have to do smaller slices to try to, because those little vessels and nerves blood vessels get caught in between those slices, and I think it's what you would call 3 centimeters of slices. And his name is Dr. Oxney in California, in south of California, and he's the dean. So it's a college, it's a school, and I'm trying to think, and apologize for not being able to say. I apologize. Later on, I'll think of the name, but you can look him up on the internet, I'm sure, and find him. But I'll give you the spelling of Dr. Oxney because it's ALKSNE, and his first name is Dr. John Oxney, ALKSNE. And he said to me, Tammy, you have clusters of blood vessels. What you get hit on a nerve is a blood vessel that's squiggled out of where it's not supposed to be, and it's hitting that nerve with every heartbeat, and you get all these strikes. And so I had brainstorms night and day because I got it on both sides, and it's a freak show going on. And my hemifacial with the blood vessel clusters. My face was so distorted. My nose was being pulled to the side. And it was an 8-hour surgery, and he had to retract my brain back at least 10 times. Quite exhausting with a team of doctors. And the clusters, I'm going to request my video of 8 hours. Hopefully will send that to me, because I would like to have that for my records. And I'm glad that I could help that college, because they have never seen, he said, I've never seen anything in my 50 years. So I can imagine, I'm not saying that any younger doctor maybe has come across someone like myself. And but in his 50 years, he never had, because I said, I feel, before I ever went into surgery, I was in such excruciating pain and out of my mind, to the point, I don't believe, in maybe some cases, truly commit suicide, but they're just trying to get it to stop, and they're doing everything they can, and it won't stop, because you can't stop the pain. with just taking some kind of drug for pain. And so they overdose and they die. And so they would consider it a suicide when I don't look at it that way. They're just you're literally out of your mind, and that's what I was. I would just be like an animal going around the house out of my mind with my brain. There's no words in a dictionary to describe what I've been through and what has happened to my brain. And I remember in ICU, I was in there over a week in California, and can you imagine, God was with me, and He released me. He said He didn't want to release me out of ICU. He said, but I will release you to your hotel room. I promised Him I'd be good, and then I had my last visit with Him to go fly home. And my flight was okay. I was medicated, of course, and taking all the drugs to help swelling of the brain and all that they give you, you know. But I did fine coming home. I of course, you had your family helping you because you can't hardly move or tilt your brain or anything like that, because it's swollen and you feel like it's in a bowl of Jell-O. It's such a strange feeling. But I cut my hair short. I was losing my hair. I looked like Dr. The doc on Back to the Future, where his hair's all out, and thin. And that's how I look, because I had long hair. I don't know if you've ever looked at some of my photos. I haven't put too many, but I've had long hair, and I just had to cut it off. They shaved me back here, and the scar was, and I'm going to put some photos of my experience of what I look like in the hospital to let you see my journey. But it was about that long here, and they had to take out all this bone here. And so normally with one nerve, with one blood vessel, would be about like that at the base of the brain, where mine was this whole section. They put fake bone, and they said it would eventually, as it heals, it would be like concrete in there. It's been very difficult after the surgery. You're not the same person. 3 nights, it's just the way it is. It's just the facts. I remember them waking me up saying, I'm giving you some medicine, Tammy, for a stroke. The doctor said, we don't know if it was the stroke or maybe permanent damage from the trigeminal neuralgia. I look quite better looking than I did when I first came out of surgery. Who wouldn't? But this side is stroked, and this eye will not close and will not blink. And I'm trying to save the cornea. I have to tape the eye down and keep it moistened with a special cream. And my eye doctors here said, well, the nerve in the brain is not swelling anymore, for my eye. They think it won't ever shut, and they want to sew it permanently here because it has the illusion of staying open because it's not blinking. Well, I look at it as, why bother just to look like the other side? And they say, you got to continue doing this, cream and taping. I mean, what's the sense? And I ain't going through no more surgery. And that's my choice. And everyone's different, and each case is different. And so I've heard of others that took 1.5 years before their eye closed. My surgery will be a year this next February. The 28th is when I had surgery of this year, February 28th. And I was allergic to the drugs that they said, well, let's try them because you are so bad and such an extreme case on the right side of the brain. Maybe they'll work now. Oh, my God. Well, you can imagine they didn't, and I was going down, and I was in the hospital. And I was, when I say going down, that drug got in my system because they're seizure meds, and my legs were just one piece of long flesh. The side effects, I had them all. And they said there's literally nothing we can give you for my left side. And unfortunately now, my brain, I don't believe, ever stopped swelling. It went quite through an ordeal, and the doctor did an excellent job. If I hadn't had the surgery, I don't believe I would be here. But to control the freak show out of this world, I wish I could find a word to describe it, but I cannot. And that was the pads they put. What they do is they put pads around the blood vessels to keep them from hitting that nerve. Well, I still get hits, but not like they were. But my brain is swelling, and they have me on the morphine. No, I'm sorry, not morphine, but steroid. And I kept saying, it hurts to even touch my hair and my scalp. My pain is it's different. I feel different, and it's really bad on the right side. Well, they did another MRI, and I sent it to the doctor in California, and he says, Tammy, you've got inflammation of the brain. Well, I didn't know, and he's an awesome doctor. He's so sweet and kind, and in between surgeries, you can imagine how busy this man is, and being the dean and all that he does, I can't imagine. He takes time, and he calls me personally, and I hung up, and he says, I'll order your medication, and you get that. And I want your primary, who you're working with. And he said, and so I'm thinking inflammation, I'm thinking infection. I didn't know because we didn't get to talk any further. I was so ill, I couldn't hold my head. I had to I'm sores on my ears just laying on my left side of the brain that has trigeminal. So I'm back and forth because this pain from the trigeminal, and then of course my brain, I couldn't touch it. Like right now, I'm getting hits where that might be the trigeminal. But I'm still here after February. I don't think the brain ever truly healed from the swelling and the bruising, I'm sure. But I was afraid to take the drug because I'm allergic. You can imagine in the hospital several times from allergic reactions taking me down. And so I went to my doctor, and I felt guilty because I know they worked very hard on me. So I thought, okay, I know. I mean, the swelling, you look like, with steroid, how big you get. That's trivial compared to what I'm going through in pain. That'll go away. But I was afraid of what the side effects. Soon as I took my first dose, I was going down, that feeling just like the drug did on the other drugs I was allergic to. Because before, when I was on the steroid after surgery, I had that euphoria feeling of feeling wonderful, that I actually was overdoing it because I was walking and tilting my head, just doing too much, where you just truly got to totally rest. There's people I know didn't get out of their house for over a year to year and a half. And here I was trying to act like I was normal. I had a lot of healing to do, and I still do, of the brain. Well, I haven't taken, goes to say I have not taken any, and that's, my primary doctor says that's all we can give you for inflammation of the brain, because I found it's swelling, and that's on my part of ignorance. But I didn't know, and I should have looked it up. I was so ill and so much pain of the swelling in my right side of my brain that I couldn't even hold a computer. And I found that I knew if I took a morphine, that pain, it helped my pain to go down to 90%, that it wasn't trigeminal, because nothing will work for trigeminal other than trying to block the signal of strikes. So I knew that it would help me to tolerate to get out of the house, just to go to the doctor, or maybe just get fresh air and see the sunshine. And I went to the health food store, and I'm taking stuff that is for inflammation. But I notice I'm not as severe of pain, but there's times I overdo it because I'm taking the morphine to mask the pain. And then of course, payday comes and I wears down. I'll start hurting. I'm God's child, and some would say I'm ignorant and I should take that drug. What do you want? That to kill you, or just let happen? I can't control. It's out of my control. I have cooperated in every way in anything with respect to my doctors and them trying to help me, and they've been nothing but caring, and I've been very fortunate, not condescending, very loving and understanding doctors. And I've been blessed this time, because I haven't always been in my past. I'm very cold and indifferent with me, because they don't want to admit I don't know. They just look at you like, you don't know what you're talking about. I don't see nothing. But he sees, if you sent and had your doctor send it to him, he sees things that nobody else sees.